and hopeful for a brighter future for all children. It's an honor to welcome Dr. Merrick back home to share her wisdom with us. Dr. Merrick?
Thank you so much, Julia, for that really kind introduction. And hello, everyone. I'm thrilled to be with you today. I wish it was in person, of course, as we had planned. But what we're learning, all of us together in this time, is how to be nimble, how to be flexible, and how to stay connected even in this virtual time. So I'm going to try to go ahead and share my screen with some slides that I have prepared. Let's see. Okay. Maybe someone wants to let me know that they can see my screen okay?
We see it perfectly, thank you.
Okay, perfect. So I first want to just thank Prevent Child Abuse Georgia, well, first of all, for inviting me, but also more importantly for their real great leadership of prevention in Georgia and really as a leader for our network. We are so fortunate to have just such active and visionary leaders in our Prevent Child Abuse state chapter network and our Healthy Families America network. And so just thanks for all that you do for Georgia's children and for, really what I can't wait for is for the release of your wonderful vision for child and family well-being in Georgia, the Essentials for Childhood Georgia team, and just everyone who I've come to know over the years very fondly. So it's nice to be back with you all today. The title is sort of my remarks this morning are really centered around prioritizing prevention and really how we must prioritize prevention in order to truly achieve child and family well-being. So this is something that I know in Georgia, you all are always striving toward, and specifically across sector with many, many partners, many of whom are on this webinar or virtual conference this morning, and many others, right? So I also want to join Julia in some of her comments about this time that we find ourselves, right? We all know that parenting is challenging even in the best of times, but parenting during a global pandemic, in a moment of really acute civil and racial unrest, and certainly with the other sort of disasters, hurricanes, wildfires, this is a time that is so stressful for families. And it's more important than ever that we stay emotionally and socially connected. So even in this time of physical distancing, we need to keep our support strong. We know that emotional and social support are such powerful protective factors year round, but particularly in a crisis like this. So I just wanna honor the heaviness of this moment, but also really highlight the great opportunity we all have to continue working together in partnership across sector, across silos, across agencies, to really create at the end of all of this, create better than normal child welfare and other child and family serving systems for children and families. So I'm just so, again, thankful for everyone and all of your partners for joining in this work. So let's see here. The slide doesn't want to go. Here we go. So I put up this slide just to kind of ground us. You heard from my brief bio. I spent 10 amazing years at the CDC with you there in Atlanta, but I'm trained as a clinical psychologist, so more individual level. That's what my degree is, in clinical psychology. And so I really learned public health on the job, right, like many of us do. And this definition always helped me refocus on what the work of public health is, right? And what it requires, what it gives us permission to do, and what it really requires us to do. So really this definition is, it says that public health is what we as a society do collectively. So not in silos, not one organization or one discipline alone, but collectively, what we do collectively to assure the conditions in which all people can be healthy. So by conditions, what do we mean, right? We're going to go a lot into that today, in which all people can be healthy. This is the intentional integration of health equity. It is our job in public health to set our children and families on a trajectory toward health and well-being, because we know through brain science, through neurodevelopment, epigenetics, endocrine system, immune system, all of the science, the hard sciences, we know that if we have healthier kids, healthier brains, we will go on to have healthier adults. It's simplistic in those terms, and obviously we know it's much more complex than that, but essentially that's the bottom line. So really what we do as a society collectively to assure the conditions in which all people can be healthy. That said, child abuse and neglect research and sort of the field did not emerge as a field that really focused on the conditions that kept all children and families healthy. We really evolved knowing a whole lot about what put families at risk for experiencing child abuse and neglect and other kinds of violence experiences in the home. And much of our early research came from the seminal Adverse Childhood Experiences, or ACEs study. So this study, as many of you know, started in the late 90s as a collaboration between Kaiser Permanente, a large HMO out of San Diego, California, and CDC. At that time, this work was housed in the Center for Chronic Disease Prevention and Health Promotion. And really, it basically asked about 17,000 adults, mostly white, mostly well-educated, all insured by nature of the HMO sample. They asked them to retrospectively report about these experiences that they may have experienced in their homes under the age of 18. So experiences of abuse, like physical, emotional, sexual abuse, neglect, and then various forms of household challenges. I point out household challenges here because the original study really referred to these experiences as family dysfunction. And certainly under my leadership at CDC, and CDC continues today to really reframe this as household challenges, because we don't want to inadvertently blame families for their own challenges, that we know we need an all of society collective approach to fixing, right? Or to helping families withstand these types of challenges. So anyway, the ACEs study asked about these kinds of experiences, and you found what? ACEs were common, about 60%, 65% of the original sample, but of pretty much any sample. We know that people experience at least one ACE. What we also know is that if you experience one ACE, you're more likely to have other adversities, many that we don't even measure, but we know that these kinds of constellation of risk factors tend to co-occur in the same families. And we found from this study that it affects our health, and we'll go into that in a moment. What I hope you see on this slide is that it's not the entire universe of early adversity that we know children in this country and around the globe are experiencing. It also doesn't get into the various dimensions of abuse, neglect, household challenges like age of onset, frequency, chronicity, who the perpetrator was, right? There's a lot of information that we don't have. And you can see there on the right side things that are not included, right, in the traditional measure. That said, what I think is so compelling about the ACEs study, and why people continue to cite it, continue to study it, continue to do their own ACE studies in different smaller populations or in different neighborhoods, urban ACEs. WHO has an international ACE questionnaire that has more comprehensive kinds of experiences for a global context. But why this is so compelling is in the simplicity of understanding the data. So the ACE score is a simple count or a sum of the number of categories of these experiences that you may have experienced. So as your ACE score goes up, you can see here a summary slide, so too does your risk for a whole host of negative health and well-being outcomes. So as your ACEs increase there on the x-axis or the horizontal axis, we know that your risk of negative health outcomes increases. Things like obesity, diabetes, depression, suicide attempts, leading causes of death like cardiovascular disease and diabetes, stroke, Health risk behaviors increase as ACE scores go up. Things like smoking, alcoholism, opioid misuse, and overdose. And then also your life potential or your life opportunities are also impacted. So things like high school non-completion, adult unemployment, living in poverty as an adult, these things are also impacted by the number of early adversities that we experience. This is a summary slide. So what you see here is this graded dose response impact or pattern that really we've found in over 45, probably up to now 60 health outcomes, right? So you see the same general pattern. Although, sometimes I get, Melissa, what about, is a score of 4 or more or worse, or 3 or more, or 5 or more? And again, it depends on the various outcome, the population, what the distribution looks like. But you can see the same general pattern that basically as your ACEs go up, so too does your risk. And we've understood that for many years, through this pyramid. So even in the early ACEs work, we had a pyramid like this, but the pyramid used to stop. The bottom layer were ACEs. So it was that ACEs, these early adverse experience that could be potentially traumatic in children's lives, really disrupted their neurodevelopment. So not just brain development, brain architecture, but also the way our genes express themselves, our immune systems, how they function, our endocrine system, which then led to some social, emotional, and cognitive impairments, right? Adoption of health risk behaviors, maybe unhealthy coping strategies like substance use and misuse, which then put us at risk for disease, disability, and social problems, and then early death, right? We know from some research in the late 90s or early 2000s, maybe that the difference in life expectancy between folks who reported 6 or more ACEs versus no ACEs was about 19 years. So a 19-year difference in life expectancy is a greater life expectancy inequity than we see in most any other illness, injury, or geographic comparison. So almost 20 years of life lost. What is so exciting about this pyramid is that in the last few years, CDC has updated this pyramid to have those bottom 2 layers. So these are things that, again, speak to the conditions, to the context, to the community environments, to the historical traumas. I've seen people use the ACE acronym to say not just adverse childhood experiences, but adverse colonial experiences. So these bottom layers really say that the trajectory toward when we observe ACEs is sometimes started generations beforehand, right? And so what I love about this update in this graphic, and I'm really proud that we were able to get this update, is because it then says we're really going to get to decreasing and preventing adverse childhood experiences like child abuse and neglect. We must care about the conditions, okay? The root causes, the structural determinants of health. If you've heard me speak before, you know that I love this pair of ACEs graphic, and I use it almost in every single presentation because I just think it has really helped everyone kind of make more concrete or more operational what we mean by root causes, what we mean by ACEs are measured generations later. So here you can see this slide where ACEs, the things we typically measure and assess, are maybe the leaves of this tree. But what produces the leaves? It's the roots, right? It's the nutrients in the soil. It's the things that have to grow for a long, long time before we even can observe any leaves. So they refer to this pair of ACEs, the adverse community environments. I prefer the language, context and conditions, because I think, again, it helps us anchor that work in the public health requisite, if you will. Like public health is what we as a society do collectively to assure the conditions, these roots in which all people can be healthy. So here we're talking about all of the things that have been exposed as of late in the context of this global pandemic and the disproportionate impact that it's having on some Black, Brown, and Indigenous communities, right? We know poverty, discrimination, all the isms, racism, income inequality, poor housing quality and affordability, all of these things are at the roots of what we are observing in ACEs. And the group, Wendy Ellis and her colleagues, have updated this for a COVID context. Again, I've also seen people in this time talk about ACEs, not just as adverse childhood experiences, but adverse COVID experiences, right? So that acronym, I think, helps us in communicating under this kind of frame of ACEs science and ACEs research, what we're also talking about. So you can see here, we're observing all of kind of the disproportionality, the impacts, the stressors for family, unemployment, lack of access to primary care, to health insurance, food insecurity, lack of access to technology. I mean, this is a stressful time for all parents, but I would be remiss to think that although I am stressed every day as a parent, I have my 2 young kids virtually learning from home. My husband and I are working from home. We're all on Zoom or some platform at the same time, and it is stressful. But you know what? We have access to technology. We have devices, we have data, we have diapers, we have all of these things, concrete supports that help take a little bit of the edge off. And so although we're all experiencing an unprecedented time, we would be remiss if we didn't acknowledge that some people, some communities, some groups that have been historically disadvantaged by our policies that have been rooted in systemic oppression and racism are even more impacted. They are experiencing a disproportionate amount of the burden. So it's just important, and I think what this graphic helps us do is to see what else is our work in this field. What other partners do we need to have at the table? And, you know, I'm thrilled to see the list of partners for this conference for this week, you know, across sector, you know, the thousands of people that gave input in the prevention plan that's getting released. I mean, it's so exciting, but where can we even challenge ourselves to be broader, to bring newer partners into this work? Housing, business, chambers of commerce, media, you know, this kind of, we all have a role to play in addressing these root causes. These are not challenges that one family can solve for themselves. Absolutely not. It is an all of society public health approach and public health requisite. And here you can just see my former health commissioner in Minnesota, Ed Ellinger, had this slide, and I really like it. Here you could see a little bit of an offshoot of the tree graphic where there's still these root causes, but now the ACEs that we typically measure are the trunk, and then you can see the diseases of disconnection and despair, kind of the health outcomes, mortality and morbidity outcomes at the top. So there's a lot of visuals in this space, but I think that they're compelling because then they require that we face these bottom layers, that sometimes when we see these bottom layers, like if we're opening a box, we're like, ooh, that's really complex, really messy, that's not our work, or that's not our lane, and we close the box and we acknowledge like that's a gap in the field. No, if we are truly going to prevent early adversity, child abuse and neglect, and other challenges for children, to set them on a life course toward health, well-being, and prosperity, we must get to these root causes. Also, if we are to achieve multiple public health goals, we want to have the healthiest children possible. I think I mentioned that earlier, but this slide is from a vital signs that CDC released late last year. I had the honor of serving as the first author on this publication, but what we basically did was looked at a whole host of health risk behavior, and socioeconomic challenge outcomes. So you can see them all listed here. And we basically, you know, did some kind of a fancy methodology that basically said how much of the outcome could be reduced if we took ACEs down from what they were in the population down to 0. Okay, so how much, it's called population attributable fraction or population attributable risk. But basically here, how you should interpret these numbers is that we could reduce adult depressive disorder by 44% in this country if we did not have ACEs. We could, you know, reduce coronary heart disease, the leading cause of death, by 13% if we did not have ACEs. We could improve unemployment by 15% if we did not have ACEs, and you can see smoking by 33%. So this translates into lives saved, right? Costs saved downstream. Preventing ACEs could prevent up to 21 million cases of depression, up to 1.9 million cases of heart disease, and up to 2.5 million cases of overweight and obesity. And the key here is that ACEs are not deterministic. It does not mean that if you have an ACE score of whatever, 10, 15, 25, because we haven't measured all the ACEs, no matter what your ACE score, it doesn't mean that you will go on to suffer these negative health impacts. It means that in the absence, primarily in the absence of the protective factors, protective relationships, safe, stable, nurturing relationships and environments, without those buffers, our odds or our risk of having these negative health outcomes increases, okay? So I just want to be very clear about what we mean and what we don't mean. And certainly what we know to be true, and certainly in Georgia, you all very well know it to be true, is that ACEs are preventable, okay? It's that we know that it's not just that child abuse and neglect happens early in life and sets our young people off on a trajectory toward poor health and well-being. We know that for so many, child abuse and neglect and other early adversity starts early in life, and then makes us more at risk for experiencing these other types of violence and victimization experiences, which then adds to the cumulative impact of the burden of these experiences on our health and well-being. So it means then that we have all of these opportunities through early childhood, adolescence, adulthood, into, across the lifespan to actually provide safe, stable, nurturing relationships and environments to really reduce the negative health impacts that could be conferred by ACEs and child abuse and neglect, which is why the role of public health and violence prevention is really on the left side of this graphic, right? To prevent violence against children, child abuse and neglect, ACEs, before it occurs, thereby stemming the flow of children and families that touch these other systems like justice, child welfare, social services, even healthcare. This graphic does not mean that we don't want primary, secondary, and tertiary prevention. We need all of it, a comprehensive approach to prevention. And we also need trauma-informed systems and responses after violence has occurred, right? To mitigate those negative health outcomes and help buffer the negative health impacts conferred by early adversity. How nationally do we call for this work to be achieved in ACEs and child abuse and neglect prevention? I know PCA Georgia and the Essentials for Childhood Georgia team know this inside and out, but for other partners that may be on this conference today, this is really the vision for our country, right? CDC's vision. CDC, the leading public health agency for the country, right? So many scientists over many years perseverated on each and every one of these words because they all reflected such an important protective context and capacity for children and families. And so the Essentials for Childhood vision is, you can see, very different than a risk reduction kind of approach. It is really, what do we want to see? If we truly want to achieve child and family well-being, if that is our goal, and I know it's the goal in the state of Georgia, which I'm so thankful for, if we're going to achieve that goal, what are the key ingredients? What are the essentials for childhood? And so they are safe, stable, nurturing relationships and environments for all children. A big mouthful, but so important. Safe, stable, nurturing relationships, of course, between parents and children, but also between parents and other adults that can be protective of children. Also between children and other adults in their, outside of their home that can sometimes buffer for a lack of these kinds of relationships in the home. So relationships with teachers and mentors and coaches. I know that this has been an area that popular media has really picked up on in terms of this time for children and not being in school in the traditional way. And certainly in March, when everyone started sheltering in place, we were concerned. What What about kids who are not being identified by teachers or seen by coaches and mentors who can, often provide that good protective stuff? Actually, PCA Arizona Executive Director Claire Luge, she says teachers, we should maybe reconceptualize that they're not just mandated reporters, but mandated supporters. So really that element of we all have a role to play in primary prevention. So the fact that teachers were not seeing kids in the same way, what did that mean for their risk, right? So it's something that I think we need to honor and understand, but we also need to know that most families, even under excruciating amounts of stress, are not harming their children. Okay, we're all trying to do the very best we can do, but we need this next part. We need safe, stable, nurturing environments to help us. What do we mean by environments? Yes, home, school, community, safe, stable, nurturing, physical environments. But we also increasingly need safe, stable, nurturing, socio-political environments. We all know that there are some policies and conditions and contexts that help support families to achieve their maximum health and life potential, and others that frankly don't cut it. And we need this for all children. Again, this is the intentional integration of health equity into this work. It's to really spotlight the strong evidence that my children will actually do better if all children are doing better. But what it's not intended to do is to disappear the groups of children that we know experience a disproportionate amount of the burden of early adversity or the burden of not having safe, stable, nurturing relationships and environments. So again, words matter. And so we need to call attention where we don't want to just assume that everyone has the same understanding of these messages. We want to be very clear that the science means that this is for all children, not just ones that look like me or go to my kid's school or live in my neighborhood, but all children. Again, a public health approach to assure the conditions in which all people can be healthy. This vision is across health and human services at the national level. So this is where we partnered, CDC, Children's Bureau, SAMHSA, Medicaid, HRSA for home visitation funds and such, to say we are all talking about the same children and families, and we serve children and families, often many of the same. So could we come up with words, language, a vision, again, that everyone could see their role in achieving that vision? And we would understand that this vision is too broad that any one organization, discipline, or agency could achieve this vision alone. So this creating the conditions for strong, thriving families and communities where children are free from harm. Another mouthful, but again, you can see really calling for, saying that this is about taking a public health approach, creating the conditions for strong, thriving families and communities. We want to see that. That's what we're trying to achieve, where children are free from harm. This work, I was so, again, honored and humbled to be able to participate in while I was on detail from CDC to the Children's Bureau and helped to get this started. But there, this was like 2.5 or so years ago. And now what I'm so pleased to announce is that we've just released this initiative, this commitment, national commitment to well-being called Thriving Families, Safer Children. This is really an opportunity to partner with communities, with various jurisdictions that you already have prevention happening. Every community has assets, has champions, has key stakeholders that are working to really create and envision that child and family well-being system. So we have just, these 4 organizations, the Children's Bureau, Prevent Child Abuse America, Casey Family Programs, and Annie E. Casey Foundation are kind of the national partners in really trying to partner with jurisdictions around the country at different levels to really spotlight what is needed to really do primary prevention in communities. How do we help meet the needs of children and families before they find themselves in crisis, not once they're known to child welfare and then we're reactionary and treatment focused. And look, that's always going to be an important part of this work, but for too long, that has been the work in child welfare. And so truly, really retraining our brains, transforming our systems and our dialogue and our narrative in this country about what it takes to prevent child abuse and neglect and other early adversity. It takes all of us working together across sector, across silo, leveraging resources, both people resources and dollar resources, doing things creatively, integrating lived experience, lived expertise of young people, of families who have been in the system, bringing their voice truly to the table on the front end to really set the course for the next generation of this work, which is really prevention focused. I mean, it's so exciting that in Georgia, you all have a vision that is so consistent, and you've just, released this, and it's the big kickoff today. I can't wait to learn more about it. But this vision for child and family well-being in Georgia, your state's child abuse and neglect prevention plan, really identifying these 5 conditions that we know we need to focus on to set our children and families on trajectories toward health and well-being and prosperity. Family economic stability, so important, rooted in science, part of CDC's technical packages on the best available evidence for preventing child abuse and neglect and other early adversity. Family resiliency, access to early childhood education, again, the foundation, the earliest learning for brain development, for epigenetics, for all of that. Family mental and physical health. Again, here's where I think it's like this dual generation approach or a multi-generational approach is so needed in this area of primary prevention, because really when we learn about parents' overdose experiences or substance use experiences, we can say, okay, now we know that that kid has an ACE score of 1. Yeah, but we could also say, now we understand a little bit about the conditions within which that parent is raising their child, and then really work around improving those conditions, right? So it's, again, taking away the stigma, the blaming, the shaming, the dominant narrative in this country for too long is that it's a bad mom or a poor family or a single parent or a dad who's not involved or whatever that is to blame for child abuse and neglect, when really it is, we all have a role to play in keeping families strong, in keeping families together, in keeping children safe with their families than from their families. I mean, it is really a shift. And I'm so just pleased that Georgia is really leading this vision, not just for the state, but as a model to other states. And then finally, community knowledge, awareness of societal factors. Again, these root causes, these structural and social determinants of health, such a key part of our work in prevention. And just to give you a little flavor, national, Prevent Child Abuse America is a national nonprofit. We are honored to have PCA Georgia as one of our state chapters. We have chapters across the country. We also have an evidence-based home visiting program called Healthy Families America. You have 7 sites in Georgia helping to serve families. But really, our vision is so complementary with all of these other national visions and the vision in Georgia. We envision a world where children can grow up happy, healthy, and prepared to succeed in supportive families and communities. Again, this is a way of explaining that we all have a role to play. It's not just someone like me who's trained as a child psychologist. Obviously, I'm a child person, right? But what happens when we talk to businesses who really, don't maybe initially see why they have a role to play in child abuse and neglect prevention? So then it's about messaging, well, your retention and reducing attrition of your current workforce if you have high quality on-site childcare for employees, right? Or what about growing brains for the future workforce, right? And wanting those healthiest children who will grow up to be the most productive citizens, right? These are all parts of our narrative. Similar to you in Georgia, for sure. I know the Essentials for Childhood team in Georgia works across the public health model, and it's not about one program or one policy. It's across the whole system, right? A comprehensive approach. You would have activities in multiple domains for Prevent Child Abuse America. This is how we kind of conceptualize how we're organized. So we have Healthy Families America, that's our program. So program level work with families. We obviously have a robust federal policy agenda and work. We also are thrilled to have partnerships across all of our states with around state policies, right? We have a government affairs initiative where we can help states think through those policy targets, but also policy challenges, and help move policy in states. We have, affinity groups and other kinds of learning collaboratives within our network that really support policy. Public engagement and impact, of course, we mean, public awareness and knowledge, but increasingly we also mean studying and exposing the norms that are needed, and norms change approaches that are needed to really change the public perception of prevention, of healthy childhoods, of futures, of prosperity and maximum health and life potential. And then our really robust state chapter network. These are the boots on the ground. These are the people that are really the change agents. And again, the PCA chapter works across partners, across sector, really with this vision of bringing people in to this work. So again, so thankful for everything PCA Georgia and all of our chapters do. Research and evaluation, obviously very cross-cutting, strategic partnerships and fundraising. And then here you can see, I know that you all already know in Georgia a lot about CDC's technical packages to prevent child abuse and neglect, intimate partner violence, sexual violence, youth violence, and suicide. So there are technical packages across the violence topics that really help to say what's the best available evidence-based strategies in each of the buckets. This one is from a more cross-cutting document, prevention document on the 6 strategies to prevent ACEs. All the child abuse and neglect specific ones are in here too. And what you'll see is the first couple of buckets are really on those conditions. Again, really aligned with your own vision for Georgia that you're releasing, really strengthening economic supports for families. We know economic stressors, job loss, livable wage, all of these things are stressors for families, which then are risks for child abuse and neglect perpetration. So how can we strengthen household financial security and family-friendly work policies to just take a little bit of the edge off for families, right? We have good growing evidence in this bucket. This bucket also was across all of the technical packages. So no matter if you were trying to reduce intimate partner violence in homes, youth violence in communities, suicide, reduce suicide risk, if you had strengthened economic supports, you were preventing those outcomes. So it's a really cross-cutting outcome. Again, it points to some of these policy level solutions that can help. If you look at a public health impact pyramid, which shows like at the tip of the iceberg, we're always treating one family at a time. And again, always going to be important. I'm trained as a clinician. That's always going to be part of the work. But the bottom layers are, these policy level strategies that help prevent ACEs and early adversity, child abuse and neglect at a population level. So we know that although policy change is hard and cumbersome, especially when we've already understood that many of our policies have been rooted in racism and systems of oppression, it's going to take a long time and all of us together to change those, but then we know that we can have impacts on a population. So things like earned income tax credit or other kinds of tax credits, childcare subsidies, this is another area that has been really exposed in this time of a global pandemic is childcare. Not just affordability, but access, availability in your own community. So childcare subsidies is in this bucket too. Family-friendly work policies. We have data from a few states that for every dollar increase in livable wage, child neglect goes down by 10%, right? So it's about wages, but it's also about predictable work schedules, right? Paid family leave. The paid leave is such a critical one because from a public health perspective, it is the same kind of policy that we needed early on in this pandemic so that people, when they were sick, could stay home. But so many people can't afford to stay home. It's choosing the risk to getting COVID versus the risk of being evicted. Okay, so recognizing that paid family leave, paid sick leave, these are good from in terms of a disease prevention, like in the context of a global pandemic, but also these things have evidence for preventing child maltreatment. So again, identifying policy levers is such an important part, and I think it's an increasingly important part in this work that we all, we know we need champions across sector to be calling for these kinds of policies. I also want to just give a nod to, we are in an election year, and Prevent Child Abuse America always puts out sort of an election guide and questions that you can ask presidential candidates. So things on, what are the funds to support these kinds of policy change? What are people's positions on expanding home visitation, right? We know for even just Healthy Families America, but all of the major models, evidence-based models in this country, we've had to all pivot to virtual home visitation or phone visitation in these times. And yes, we've provided a lifeline for tens of thousands of families in this time. But across all of the evidence-based models, we are only meeting, even in a normal year, about 3% of the families that could really benefit from early home visitation programs. So in the election guide, you'll see questions around support for McV funds and HRSA and other things. So anyway, that's just a resource that I encourage you to look for, given what an important time we all find ourselves in. You can see the second bucket here, promoting social norms that protect against violence and adversity, again, to counter this still very prevalent belief that it's a bad mom or single parent or non-engaged father that leads to violence and adversity, versus we all have a role to play and in ensuring positive health and development, positive parenting strategies. And then you can see the other buckets go to more individual. It starts kind of on the big policy, but then, on the bottom right, you can see lessening harms and preventing future risks. So of course, we want to also mitigate negative health outcomes and consequences once early adversity has occurred. But we recognize that if we really have a transformational shift in this country, where right now our foster care system, we have about $10 billion in foster care. And we have about $30 million in prevention at ACF, at Children's Bureau. What if we took just $1 billion and put it over to prevention? What would that look like? What if we really make our investments early and often in a family, in a community, before the family or community is in crisis? What would those outcomes be for children? And we know that we've never done this for a full generation. We've never invested in a full generation, 20, 25 years in children's health and well-being. And I hope that all of these national efforts, national visions, national commitment, partnered with these state level visions and commitments, that ultimately we can transform our systems to really be about prioritizing prevention in order to prioritize child and family well-being. This goes without saying that prevention happens in partnership. This is not work that Prevent Child Abuse America can do alone, CDC can do alone, the state of Georgia can do alone. This is really coming across sector, across discipline, across agency, silo, funding stream, across state, across topic, frankly. Again, one other, I think, real positive of ACEs is it helps us transcend multiple of the violence topics, teen dating violence, youth violence, suicide, all of these, Because if these violence experiences like child abuse and neglect and other early adversity happen in the home under the age of 18, you know, that's still ACEs. That's the kind of umbrella term of things, adverse experiences that are happening to young people. So it really requires us to not care who gets the credit, to say things hundreds of times before people get it. You know, as a clinician, you always tell parents, you know, it can take 11 presentations of a food before a child knows if their taste buds really develop that they like it or not, you know. And I think it could take, I don't know, 111 presentations of the exact same prevention message for sometimes for people to be like, oh, I get it, I get my role. So it's about consistent messaging across sector with partners, bringing in newer partners into this work. And ultimately, I love this graphic from the Mark work, Mobilizing Action for Resilient Communities. It's managed out of the Health Federation of Philadelphia. You can see, again, a tree graphic invoked here, but here you can see they show purposefully, what if we were to replace those roots, the soil, the nutrients that we saw in the Paravaceous tree that had, you know, all the isms and income inequality and poverty and all of these adverse contexts. What if we replace those with things like faith, jobs, safety, support, community, therapy, empowerment, like all these good things, safe, stable, nurturing relationships and environments? What if that was at the core? What would be the leaves that we'd be able to measure and observe then? It would be things like love, trust, health, prosperity, resilience, peace, all the things that I know in Georgia and well beyond, we are all working to achieve in partnership. So I think, you know, we've come to the end of my prepared remarks. I just want to thank you for the work that each and every one of you do every day to help achieve that vision of a child and family well-being system in Georgia and around the country. It takes all of us and many, many others working together to really transform our systems and do better than normal after this pandemic for our kids and families. Thanks very much.
Thank you so much, Dr. Merrick. Gosh, so much to unpack here. I just want to thank you. I love that you were able to share your wisdom, your passion, your compassion with for those of us here in Georgia and for those that are listening, you know, not in Georgia. The groundwork that you all have led with at the CDC and PCA America has certainly impacted the work that we're doing here in Georgia. And so we're really excited to see how we have been able to continue to beat that drum with that consistent messaging. I feel like I'm a broken record. I feel like I say the same things over and over, but you're absolutely right. We need to keep pushing this message. And so thank you again for being here with us. I really, really appreciate it. And before we transition on to our award, I wanted to let you know that we did not have time for questions this morning, but the slides will be posted and will be emailed out to all of our attendees. So please be on the lookout for that. So again, Dr. Merrick, thank you for being here with us.
Thank you.
And so with that, I'd like to take some time to talk about a very special time for us, the Mark Chaffin Community Award, which is given in honor of the life and legacy of Dr. Mark Chaffin. Dr. Chaffin was a leader in the field of child maltreatment research. His main areas of research focus on child abuse and neglect and delinquency intervention and service systems, particularly the development and implementation of evidence-based prevention and treatment approaches within the public sector service systems. I think you all heard a little bit about that just a few minutes ago. He dedicated his career to helping at-risk children and families with a sense of fundamental ethics and the need to do the right thing. This award recognizes an individual who has made repeated, significant, and outstanding contributions and commitment to the prevention of child abuse and neglect in Georgia, as demonstrated by consistent involvement and strong leadership in child abuse prevention, recognition by colleagues and peers as an informed, passionate prevention leader, advocacy for and or participation in prevention strategies at the individual, community, or societal level that have the greatest potential to ensure that children and families have safe, stable, nurturing relationships and environments. And the ability to motivate and bring together multiple individuals, groups, sectors in support of prevention strategies, policies, and practices with data-supported results. So the person that has been selected for this award is Dr. David Earnest. And I would like to introduce you all to Carol Steele, who will be presenting the award to Dr. Earnest. Carol is the former director of the Office of Prevention and Family Support, which is now known as the Prevention and Community Support Section at DFACS, and a longtime friend and supporter to the Prevent Child Abuse Georgia Network. We're really thrilled to welcome Carol here with us today.
Hi, everyone. Can you hear me?
Hi, Carol. Yes. Great to see
Hi.
you.
Good to see you too. To all my dear friends and colleagues, hello from surviving California. Although it is 3 hours earlier here, I would not miss this moment for the world for my dear friend, Dr. David Earnest, who I call Dave. Who is more deserving than Dr. David Earnest? Dave has always dedicated his career and life to doing the right thing by children and families. Dave is recognized by his peers and colleagues as an informed, passionate leader, prevention leader, for the last 33 plus years. Dave started his illustrious career fighting the good fight for prevention back in 1987, when I believe someone named Mike Steele hired him as a regional director for PCA Georgia. And Dave, he sends his congratulations your way. His accomplishments are many, and just to name a few, during his tenure at PCA Georgia, he managed the development of a network of nonprofits that grew from 12 to 66. He implemented an assortment of trainings for healthcare providers, law enforcement, daycare, education professionals. He implemented training on board development, branding, strategic planning, evidence-based outcomes for communities and national organizations and regional organizations. He also, back in 2007 and 8, served as a team member in a CDC-funded project on evidence-based practices in child abuse prevention. And while executive director at PCA Athens, the agency budget increased by 20%, the number of employees grew exponentially, and the number of service numbers to children and families increased each year during his 6-year tenure. He served on the first Clark County Child Abuse Prevention Committee, Protocol Committee, and the Clark County Child Fatality Review Committee. And he was the recipient of the United Way of Northeast Georgia's 2020 Live United Award. And the list goes on and on and on. And if that wasn't enough, I would like to read you his nomination from his colleague at Prevent Child Abuse Georgia and a tribute from Julia Day Neighbors. So give me 1 second. I could not think of a more deserving candidate for this award than Dr. David Earnest. Dave has decided to retire at the end of this year and has dedicated his career to the prevention of child abuse and neglect. Dave worked with Prevent Child Abuse Georgia to help start most of the councils around the state. He would travel around the state and provide technical assistance to sites and provide a wealth of expertise to sites. When David applied for the position as executive director of Prevent Child Abuse Athens, he said it was like coming home. He has always been passionate about the mission and believes in the programs that are designed to support families and prevent abuse. Dave has been a leader across the state for many, many years. He is an incredible leader and truly cares for the people he works with. He speaks passionately about child abuse and neglect and helps raise awareness and dollars for this mission. In addition, Julia Neighbors is grateful for Dave's leadership to the network and especially his support to Prevent Child Abuse Georgia when it was relaunched. Dave's contributions to the network and the Athens-Clarke area have firmly rooted us as we collectively continue to sow the seeds of improving child and family well-being in Georgia. Lastly, I just want to say that I am honored to be able to present this award to my long-term colleague and my dear friend, Dr. David Earnest. I am blessed to have walked side by side with you in the prevention world. Congratulations to the guy who always does the right thing and has been our moral and ethical compass for improving outcomes for children and families in the Northeast region and across all of Georgia. Congratulations, David.
Well, thank you. Can you hear me? Oh, there we go. Can you hear me? Carol, that couldn't have been more special. That was a very special surprise for me, for you to be the presenter. Those of you who know me best know that I'm better at giving recognition than I am receiving it. So this is very special to me. I recall 4 years ago when Dr. Chaffin was recognized posthumously at the PCA Georgia conference. A colleague accepted the award on behalf of Dr. Chaffin, and his words were certainly a fitting tribute to an extraordinary man. Mark Chaffin's expertise in and passion for evidence-based strategies to prevent child maltreatment made him a truly remarkable person. In all honesty, I don't think of myself as a remarkable person, but I did have the privilege of working with many people who did remarkable things in their communities to make this a better world for children. I smile when I think about 25 years ago when somebody asked one of my sons what his dad did for a living, and his reply was, "Dad goes to meetings." When I reflect on my career, that's actually a fitting characterization. The last 34 years of my life have been dedicated to helping those least likely to help themselves. However, my role was to assist in creating and sustaining community-based organizations whose volunteers and staff then planned and implemented programs and activities in support of strong families. That's what I plan on that's what I'm going to keep on doing until December when I leave and retire. In truth, it's their work is why I'm being recognized today. And I can't imagine a more rewarding career. Before I mute myself, there are a few people I have to thank, and just some of those who made my career so enjoyable. And they include the current staff and board at Prevent Child Abuse Athens. If I name one, I've got to name them all, so I can't do that. I don't have enough time. However, their dedication to families in the Athens area is extraordinary. The staff at Prevent Child Abuse Georgia, Julia Neighbors, Jill Walsh, Nisha McDowell, and my longtime friend Jeanette Myers, thank you for reviving and sustaining and growing the network. The thousands of board members, volunteers, and staff in the Chartered Council Network that I worked with during the last 28 years. Sandra Alexander and Carol Steele, both friends and colleagues at Prevent Child Abuse Georgia, both made an incredible impression on me as a leader and an advocate for children. Carol was my executive assistant at Prevent Child Abuse Georgia for over 20 years. And it was she was the real brain and the organization behind our work with the chartered councils. Finally, and most importantly, my sons, Robert and JT, and my wife, Margaret. Margaret endured with a great smile, the nonprofit salaries, the long hours and travel that my job demanded. Most importantly, Margaret was always my #1 volunteer at all the agencies I led. My work's email signature for my entire career has been a Confucius quote that says, "Find a job you love and you'll never have to work a day in your life." Well, I was fortunate enough to find that type of job, and I lived that thought out. So in some ways, that makes me the laziest man in the world. Receiving an award like this that pays tribute to Dr. Chaffin is humbling, and I'm profoundly grateful. Thank you for this recognition, and thank each of you for your efforts to create great childhoods for all children.
Thank you so much, Dave. I know it's so anticlimactic not to have all the faces around us cheering and everything like that, but we truly appreciate you being here today, and Carol for giving that speech. We know you guys have known each other for so long. And now we're going to have Nisha McDowell come give us just a couple more housekeeping tips.
Awesome. Thank you, Jill. And congratulations again, Dave. As Jill said, we would have much rather had you in a room full of folks who